After your baby is born, you and your wife may experience a wide range of feelings, from excitement and happiness to being overwhelmed and uncertain. This range in feelings that come with adding a new baby to your family is normal. Most women experience the baby blues shortly after giving birth, with feelings of sadness, irritability, and difficulty sleeping. These feelings often are caused by the sudden and severe drop of hormones in the days following delivery. These feelings usually go away in a week or two, but for 10 to 20% of women, feelings of sadness, agitation, or anxiety are more intense and don't resolve themselves or go away. These intense feelings, lasting longer than 2 weeks after delivery, are called postpartum depression. Postpartum depression can happen any time within the first year after childbirth, interfering with daily living.
For the first week, things were tough, but I'm guessing there wasn't anything out of the ordinary for being first-time parents, staying up late, waking up in the middle of the night. Things seemed to be going normal.
And about a week to 10 days after I delivered, I just plummeted into a depression.
We woke up that morning and I remember seeing Melissa on the couch, and it was like a light switch. Something had changed. Something very heavy had come upon Melissa, and it was that obvious. The Melissa I saw sitting on the couch that morning was not able to do some of the smallest things that you would expect a kid to do. She just was paralyzed.
I became scared. I became scared of what could happen to me, what I could do to myself. I never had thoughts of being suicidal, but I just had no confidence in who I was, what I could do, or what I was capable or incapable of.
Signs and symptoms include loss of interest or pleasure in doing things, feeling down, depressed, hopeless, sleeping difficulties, eating difficulties, frequent crying, trouble concentrating, feelings of guilt, anxiety, excessive worry or fears, feeling overwhelmed, irritability, and even thoughts of death. If your wife develops some of these symptoms, she needs help from a healthcare professional. These symptoms are not your fault, and they aren't her fault. Postpartum depression is a combination of biological risk factors such as genetics and the body's response to hormones as well as stress. If you and your wife have experienced ongoing stress before the birth of the new baby, she will be at higher risk. This stress may include a family illness or death, ongoing conflict between the two of you, severe financial stress, a recent move, or a baby with medical needs.
Symptoms that I experienced with postpartum depression initially right away were feelings of complete despair, complete hopelessness, and these feelings came on suddenly and they came on fully. So I didn't just feel a little sad or a little weepy or a little teary or a little out of the ordinary. I felt completely foreign to myself. My husband, because of who he is and the caring man he is, and I think because of the education that he was given at discharge, knew that I was not right.
The nurse that discharged us had talked about it and looked me in the eye and said, "Jed, you need to watch for this, and this is what you need to watch for."
She gave me an extremely thorough discharge that she verbally went through everything with me, including postpartum depression and the signs and symptoms. And she also did this with my husband and my mother present, which proved to be key for me later, because those are two of the people that, number one, supported me, and number two, just recognized how different I was.
What you can do to help. Help care for the baby. Offer to help with the baby. Entertain other children in the home and do household chores. Lower your expectations. Don't expect more than she is able to do or give. Don't take her irritability personally. Irritability is a symptom of depression. Instead, ask her to tell you what she needs. Let her sleep at night. Her recovery will go quicker if she gets needed rest. What you can say: we'll get through this together. I can see how hard this is for you. I'm sorry you are suffering so. It will get better, but it's going to take time. You are doing a good job, and give her examples. You're a great mom. This isn't your fault. You wouldn't blame me if I was ill. Tell me what I can do that would help. Or tell me if I am doing something without realizing it that is making it harder. I love you very much.
You need to find people in your life, key people, and talk to them about it. By key people, I mean parents, a good friend, a boss, just those people in your life that you're going to need help from. It takes a lot of energy to take care of your new baby, to take care of your wife, but the load can be lightened. You have to be a very, very unselfish person. But at the same time, your wife needs you, and she needs you in a way like she's never needed you before.
Things you should not say. Just think positively. We have a beautiful baby. Recovery is not that simple. Just relax. This tends to make someone feel worse. Snap out of it. If she could, she would. No one wants to feel depressed. You will need support as well. Recovery from depression takes time. There is no quick fix.
I knew to really be the mother I wanted to be, before I did anything, I had to get help for myself. I had to get better. I wanted this child. I chose to bring her into this world, and I was obligated for her to get better. And that meant coming forward and saying, I have depression. That meant coming forward and saying, I don't know if I can care for her. Me getting better is her getting the mother she deserves.
You and your partner need not face this illness alone. Seek out a healthcare provider. Postpartum depression can effectively be treated with counseling or medication. In severe cases, the most effective treatment is both. Talk to your obstetrician or primary care doctor. You can ask for a referral to a counseling center in your area or call the behavioral health clinic and ask for an assessment for postpartum depression.